There is so much that we can't control when we take our child into a medical environment. We don't know what our child's emotional reaction is going to be. We don't know how the care team is going to be that day. But when you see a child life specialist in the wild, in the hospital, walking around, you do see them with a bag full of so many different things. And so, what we have done is we have put together a checklist of things that parents can bring along to every appointment for kids, infants, all the way up through school age. So, if you go to childlifeoncall.com/free checklist, you can download this free checklist and it will at least prepare you to know what to put in the bag that you need to bring with you to these appointments so that you can communicate with the care team as best as possible and focus on your child without wondering, do I have what I need? It's a starting point. Go to childlifeoncall.com/free checklist to prepare for your child's next doctor visit. You're listening to episode 187, Kayleigh's Story, a child life specialist with a son with Tetralogy of Fallot, part 2. Hello, my friends. Welcome to Child Life on Call. This podcast is a safe place for parents to share their stories about what it's like to have a child that has a medical experience, diagnosis, disease, and or everything in between. We know there's power in sharing stories, and that power multiplies when you can listen to other parents who have walked a similar path to yours. Giving and getting advice is great, but hearing how another parent navigates the complexities and nuances of healthcare is even better. As a child life specialist, my role is to support, validate, and provide emotionally safe spaces for kids and their families, and I am so honored to be on this journey with you. In addition to parent stories, we sprinkle in some expert episodes every now and again that have content for both parents and professionals in the field of healthcare, all with the mission to empower parents to be confident advocates and partners with the care team during healthcare experiences. We're so glad you're here. Hello, my friends. I'm so happy that you're here today. Thank you for being so patient with us as you waited for part 2 of this episode. I promise that it will be worth it. Absolutely. Kayleigh is such an incredible mom, as I'm sure you heard even from the second that she found out she was pregnant. Her instincts, her ability to trust her gut, and really persevere for what she and her son needed is so evident. So, thank you for your patience. It is well worth the wait, and let's go ahead and get started with part 2. By the way, I am Katie Taylor, a certified child life specialist and the host of this podcast. If you are joining us for the first time, this podcast is a resource for parents as they are navigating their child's diagnosis, medical illness, hospitalization, so that they know that they are not alone. Other parents have gone through this before and can offer a lot of support in terms of their words, their experiences, and what they have gone through. So we're so glad that you're here. If you haven't, go listen to the previous episode 186, so that you hear part 1 of Kayleigh's story. It is incredible, and it is very important so that you get the context of this one. We're so glad you're here. There's 2 things I really want to talk with you about. And one is this. I feel like we could talk for so many hours about, I want to just keep hearing everything, but the 2 things I want to hear about now are, now you keep saying, like, look, when I look back, I wish, what is the work that you have done now to acknowledge how you're feeling? And then after that, I want to talk about, you mentioned at the beginning too, some of the advocacy skills that you learned, because that's a theme we hear on this podcast all the time. And advocating is messy and exhausting and overwhelming and pisses you off sometimes,
Yes, it
but
does.
is also incredibly like empowering and like collaborative and beneficial. The theme of this podcast should be like everything all at once.
Yes, 100%.
So those are the 2 things I want to chat with you about, and then we'll have you back because I want to hear more. But let's talk about like this reflection that you're working in right now. And I'm sure some has just come with time and, meeting your child. But tell us a little bit about where you are now.
Yeah, so when he was born, he spent 4 days in the NICU, and I packed a bag for a month. I was ready to be there all day, every day. He has, with tetralogy of flow, there's two ways that the heart defect can go. It can be you're born a blue tet, which means you need surgery right away, or a pink tet, meaning that you have this heart defect, but you can exist with it and you can get surgery a little bit later. There is an incredible movie called Something the Lord Made, and it's about another hospital, Johns Hopkins, of the surgery that they did for TETs. And it was something that is just a really cool movie. If anybody ever wants to see it or is going through a similar diagnosis, just really something cool to kind of learn about it from a different angle. But so we were very fortunate. He was a pink tet. He was able to go home. We were able to manage him outpatient for 3.5 months before he needed his surgery. The first 1.5 years of his life, I handled it terribly. I thought I was doing a really good job. But what I know now is that I was dealing with PTSD, which again felt like such a fraud diagnosis because my story was good. My kid had his heart surgery. He did beautiful in it. He was discharged 4 days after open heart surgery and learned to roll over the next day when we went home. And nowhere in the discharge summary did it say sternal precautions with a brand new roller. He thrived, right? So I should be thriving too. And I wasn't. And I had so much trauma, but I didn't know how to acknowledge that trauma because who am I to be traumatized when, again, so much worse could have happened. And so for the first year, I just kind of existed. I was so connected to this little human. I loved him more than anything I ever could, but I wasn't connected to myself. And that was almost just as scary. I remember going to the pediatrician office and filling out the thing about postpartum depression. And I was filling it out, and every time it's, how many times do you think about hurting yourself, hurting your baby? And I was having the opposite. I was so afraid that somebody else was going to hurt him, or somebody else was going to take him away, or what if, the spiraling of what if some crazy thing happens. And I was the opposite. So as I'm filling that out, I wasn't marking or causing any cause of concern for postpartum depression. What I didn't know was that postpartum anxiety was a real thing. I don't feel like postpartum depression is talked about enough in the world. Postpartum anxiety is even more quiet topic, and I don't know why. And I was really struggling with that. And then in came a pandemic. He was born in 2019. We celebrated his first birthday, and 2 weeks later, the world shut down. And I had no idea how to handle that. My reserve was completely gone because if this heart defect didn't take him, then I guess this pandemic will. It was just always something else became this huge threat. I am very thankful for my husband. We are not a couple who does ultimatums, because my personality is, if you give me an ultimatum, I will choose whatever you're telling me not to just to spite you, because I don't like being controlled. He came to me and he said to me, we need you to get help. Your anxiety is something that I can't support you through. I can't fix it for you. And he only knew the surface of it. I wasn't sharing with him all of the spiraling that was happening. He only knew what I thought I was hiding, but wasn't. Because of my husband, I talked to a really good friend of mine who I knew had therapy herself, who had done EMDR, which is rapid eye movement to help you process through traumas. And I went to her and I said, I need help. And she helped get me connected with this therapist, and I did therapy. Having a therapist who validated everything, who said it's okay that I was angry when people told me it was going to be okay, or validated that it was a really weird combination of supporting families in their worst days when I was existing in mine, that I didn't fail as a child life specialist, because I did connect with some families, and there's a family that you would go to the room and she would share about her child and I would share about mine, because she knew something, that her child was in the ICU the entire year of my pregnancy and the open heart surgery and discharge. So she walked alongside this. And it was so nice to have a therapist tell me that I didn't do something wrong because I connected and because I shared a personal part of my story. I think that's something in child life that we have to support students through too, of it's okay to connect on a personal level, why you're doing it, how you're doing it, what those next steps look like matter. But we're doing human work. We're doing real life emotion, real life experiences. We have to find a way to navigate that together. And so the therapist was huge to just validate, like, PTSD is a real thing and I can have it even though I'm not experiencing something else that I feel like is more traumatic. She helped me learn that my trauma is my trauma and somebody else's trauma is theirs. And trauma is not a comparable thing. It is not a one size fits all. It is okay to say I was traumatized by this, and it doesn't make me any better or worse than the next person. And I think that that was something that was so validating and comforting, was just, it's okay to have trauma. So therapy was huge. It was necessary. Once I was able to work through some of that therapy, I was able to give myself permission to also start anxiety medications to just take away some of that. I was just always so heightened that I couldn't work through a lot because I was just constantly at a 10. That anxiety medicine was able to kind of take me down to just be able to exist with it, to then heal from it. I had to make a really hard decision that at that time, the PICU I loved, but through everything, I needed to not have my worlds colliding so much the same, because I felt this, I almost couldn't do my job as well because these people saved my kid's life. So how can I push back ever? The PICU saved my life too. Like, I am forever so grateful of them. I understand nursing and doctors so much differently because I loved how human they were for me, but I also needed to separate my worlds. And so I am now working in a NICU and I love it. I get to see the babies. I get to still see really difficult things, but it's not a kid coming in at 15 with tetralogy of Fallot who's needing a heart repair and instantly seeing my kid. In the PICU, I saw my son in everyone, because it was either they had a heart defect and so I could relate, or they were walking down the street and were hit by a car, or in Baltimore, there's a lot of gun violence. Like, there were just so many other reminders of, like, okay, well, if the heart defect doesn't steal him from me, what else might? And so getting that permission that it was okay to say I need a change of environment is still something I struggle with, because that PICU was my bread and butter. I love that environment. But having a therapist say, like, have you ever thought about giving yourself the grace to walk away? And the last really big thing was to just finally talk about it, out loud, to own it, to tell people it's okay if your pregnancy isn't what you dreamt it would be. To, in a NICU setting, talk with families about postpartum anxiety and postpartum depression, and tell them it is okay to not be okay, that it's okay to be drowning and to be angry and to be sad. It doesn't mean you don't love your baby. But it's okay to be sad that your story didn't go. So I think one of the biggest things I learned is not, there's this theory of I love you, but I'm disappointed with your behavior, right? Like, there's this but in between something. I've worked really hard to live in the world of, with a 4-year-old, I love you, and I'm frustrated that you just hit your friend. Saying that to myself, my pregnancy didn't go the way I wanted it to, and it went the way it needed to. It's living with the and instead of the but that has given me permission to coexist with the messiness of even now.
Oh my goodness. I just want to wrap up everything you say and play it for every parent and myself. You're just giving such good reminders and permission. Yeah, I think it's worth it to find that therapist that
Mhm,
you have that connection and relationship with,
mhm,
and who just gives you that permission and validation, and you look forward to having that moment.
mhm.
And if you can do it in person, like virtual is a great option if you
Yep.
don't have access, but if you do, I myself have done EMDR. I remember after
Mhm.
the first time and I was just like not okay, and she's like,
Yep.
"Wow, you have been holding in so much trauma for so long that this is
Uh-huh.
actually alarming." And that didn't scare me. It was like so validating, that like,
Right.
wow. And
Right.
what your part about what we teach to students in child life, just about for so long, our boundaries have been so black and white, and probably some of the most
Mhm.
strict boundaries on the face of the earth.
Yes.
You turn it off,
Yes.
you turn yourself off when you
Yes.
go into that room. And I
Right.
think for a long time it was protection. But
Mhm.
I've also, like, talking with you right now and talking with parents over the past 6 years on this podcast, I have felt more free to really love and
Mhm.
pour into them because I don't have that hospital boundary that I usually do.
Right.
Oh, that would be a whole other topic for us.
Yes, it would.
Oh, we'll be right back. One of the things I am asked the most often as a child life specialist, not only by the patients and families that I've worked with, but by my friends, is how can you support and prepare your child for a shot? And as a parent myself, I know sometimes it's so hard to even concentrate on what the doctor is saying because I'm so nervous about my child having to get a shot. And yes, that's even coming from a child life specialist. Thankfully, I can rely on what I know about child development, family centered care, and trauma informed care to pull on medical stressors that could come up for my child, and I know how to support them through it. And now we want to give parents those same tools that child life specialists use. And that's why I'm so excited to share with you our new course that's made just for parents. We have worked with instructional designers who are experts in making courses online. We want to put you, the parent, in the driver's seat of these appointments. What we do is we go by age group and tell you exactly what the stressors could be for your child and what the interventions are that a child life specialist would use to help your child through having to get some sort of poke. If you're a parent who wants to walk into your child's medical appointment and instead of feeling overwhelmed with anxiety, you want to feel empowered and know how to prepare and support your child and how to advocate for them, then this is the course for you. This course will only be available for 4 weeks, so go make sure you pre-enroll for the course this fall. Go to childlifeoncall.com/mychildneedsashot. That's childlifeoncall.com/mychildneedsashot. So you also expressed, not only just advocating for your son and yourself,
Mhm.
but like advocating in your job for other families, and
Mhm.
how I'm sure you just have this perspective on advocacy now. One of the questions I really want for other parents to hear your answer to is, what does advocating look like? And when you're in the hospital, I want to talk about like at rounds or when something's
Mhm.
happening that you know shouldn't or you're not sure should be happening. Like, what is the right way to approach that? And did you find yourself in that scenario, and how did you handle it?
Yeah, so I always joke with slight truth, that I'm pretty sure I may have been flagged in my chart. Obviously, I'll never know, but I think I was flagged because I distinctly remember one of our first scans. So we had to get scanned every 2 weeks to make sure that his heart was growing and to kind of follow everything. Um, and we had our first appointment at 7:30 in the morning, and it was perfect. I could then go do my appointment, only have to take, a half an hour, maybe an hour away from work. My husband could attend, still get his job done. Knowing this was every 2 weeks, we couldn't drain our time because we knew we needed time. I needed a maternity leave. I would have loved having a critically ill child leave that wasn't also a maternity leave combined. My husband needed paternity, so we were really protective of our PTO. And so I remember one appointment and I had said, okay, we'll see you at 7:30. And the doctor was like, actually, I really need you in it at 9:00, because that's what fit. And I was like, well, that's not going to work. I need to do 7:30. This is why. And she told me I was being difficult. And here I was, an educated, employed by the same hospital. It's just this level of how am I being difficult? I'm using my I statements. I'm using effective communication. I'm explaining what it is that I need. My husband jokes, he was like, this is the moment I knew she was a mom, because he was like, I watched you put your purse down and stand up. And he said, that's when I backed into a corner and let you do your job. And I said, I hear your frustration. However, I need you to meet, we need to meet in the middle. I need to do 7:30. If there is something wrong on the scan, I work a few floors down. You call me, I will come right back. But this is what I need. And that was the moment that I understood advocating in such a different way, because it was here I was trying to do something that I'm being compliant with medical, but I also needed to protect, I needed this job. I needed health insurance. My son's heart stuff, all said and done, was probably close to $1 million. I wasn't paying that out of pocket. I would
Yeah.
be, it would be impossible. I needed that health insurance. And so I was just so disappointed in that moment, because I realized how many families have felt this way before, how many families have felt like they had to meet the needs of the doctors rather than us meeting the needs of the families. How can we do both? How can we coexist? What it did was empowered me to speak up throughout my pregnancy. I was very fortunate to have a really good relationship with all different levels. I believe that in child life, to be successful, you need your medical team on your side, or you're never going to have a spot at the bedside. I worked really hard for that, and I didn't want to lose it. And so I would go to them and share different experiences that I had and said, hey guys, we're failing. If this is what it is, we had to change cardiologists at one point, because one of the cardiologists that followed us had left. And at one point I was told we were lost to follow up. And I was like, lost to follow up? I work here. How was I lost to follow up? And I said, if this is hard enough for me, and I'm working and my kid is not that complex, how hard is it for other people? And so I learned how to speak up and say, I remember the day of his heart surgery, the phone was how you would get updates, and I picked it up and it had static in the background that sounded like a flat line. So I picked up that phone hearing that, and I was like, oh my God, he died and they're calling me over the phone, which talk about postpartum anxiety here, triggering moments. And so I was able to bring that and say, hey, we need different things. I was pumping facing a window because my family's in there and there's nowhere to pump, and I'm attached to this corded phone. So I was able to do a lot of advocating in that way for families, and connect with different foundations. There's a foundation that I've connected with, and the Kruger Hat Trick, and they're phenomenal for Maryland families, and other families, of just, they support families in so many different ways. So I was able to connect with them to help advocate. As a child life specialist, my advocating looked as, if I was intimidated to speak up and to advocate as a child life specialist, then how must that family be feeling? If I don't feel safe, or if I don't feel comfortable to speak up, I can only imagine how that family might feel. I remember that, when it's your kid, you don't want to make anybody mad, right? You have this fear that if I make the teacher mad, or the daycare provider mad, or this, they're going to treat my child differently. And so finding that way to talk with families to say, I know, if there's something going on, let me know and we can help talk to the team together, because I know that this may be a fear of yours. And how many families just have that, yes, that is what I'm afraid of. I'm afraid if I speak up, people will treat my child differently. And so the way that I have helped kind of talk with families is, there's advocating effectively, and then there are those when we yell and we scream and we use curse words and derogatory, that's not going to get us anywhere. But when you use those I statements, when you say, I am not feeling heard because, or I feel like X, Y, and Z, nobody can argue with your emotions. Your emotions are yours. Nobody can say you should or shouldn't be happy, or you should or shouldn't be mad. If you feel like you're not being heard, then you have that right to speak up. You are the voice for your child. Advocating for what does self-care look like when you refuse to leave a bedside. That is something everybody would talk to me, oh, you got to go home and take a shower. I wasn't leaving that bedside. It was 4 days. I left for a half an hour to take a shower at a hotel 2 minutes away. And that was the hardest, 20 minutes away from that bedside. So it's really just hoping that families know that they are their child's voice, but sometimes that's a lot of pressure too, because we're meant to be their parent, right? We're meant to decide if we're going to do homemade baby food or jarred baby food. Do you want name brand diapers or store brand diapers? Are you going to have a wipe warmer or not? Those are the choices as a parent we're supposed to make. You are not supposed to have to make the decision. Do you want your child's heart surgery at 2 weeks or 3 months? Or do you want this narcotic or that narcotic? You shouldn't have to make the decision of life support or no life support. There is no rule book for that. There is no navigating that as a parent, because sometimes you need permission from people to not be able to make the decision, and it doesn't fail you as a parent. And so I've also tried really hard to remind remind different teams that I work with of, we sometimes need to help make the decision and take the pressure from the family of, in our medical opinion, this is the right thing, and then give the families information and let them process it. Because so many times I think this pressure of like, well, you tell us what your child, you know your child best. And it's like, I do, but sometimes I don't know what's right for their heart. My kid needed a cath and it was in a pandemic. And so it's like, well, we can wait, we can do it now. Like, what do you think? And I was like, what do I think? I have no idea.
Yeah.
And I finally said to our cardiologist, like, I need you to make the decision, because no matter what I decide, if something goes wrong, right? If I wait to do the cath and he has a problem, then that's on me. If I don't choose to wait and then something happens, I have to live with this. I have to lay my head down. I have to know I fought for my kid. I need you to sometimes make those hard decisions, and then I could give you my opinion after that.
Yeah.
So I think for parents, I just hope that as they navigate this, there is no right or wrong necessarily, but there's a healthy and an unhealthy. And that's something that I've tried really hard of, talking to kids, right? Like, you can be angry, that's fine, but you can't kick your nurse, right? So what can you do? We can punch a pillow, we can scream into a pillow, we can throw paint out of canvas, we can do medical dart, like we can do a lot of things to get that anger out. There's those boundaries. So I think that's, healthy versus unhealthy is the approach I've tried to take instead of right or wrong.
That's so beautifully put. And it gives that permission to know that you're always not going to get it right too. You're not always going to choose the healthy way to advocate, because you're a human who's exhausted and making crazy decisions that you never imagined.
Right.
But you can come back from that. Like,
Right.
The fact that you were flagged is just hysterical. And I love it. I always say, like, we say when kids fight back, right? It means that they're spunky. It means that they're saying, this is not right with me. This is not okay.
Right.
So like when parents are flagged, I'm kind of like, I get it. Like, you're saying this is not right with me. But like, there's a two-way street, and they have to get their job done and you have to get your job done. Like, how can we come at this together?
Exactly.
Well, Kayleigh, I have loved every moment of talking with you. I want to just continue to do it. But for the sake of like podcasting, I'm sure people are still listening, even though we've been talking for almost an hour. I could keep going. What would you recommend for Tetralogy of Fellow Parents? You mentioned the organization in Maryland. What are some of your other favorite resources? What other pieces of advice do you have?
Yeah, I think one thing I had to learn is that every resource is so different for every person. My husband loved the support groups. I couldn't do them. And so I think it's tap into your resources at the hospital as you're navigating this, talking to social work, talking to child life, talking to nurse practitioners, different people. What are the resources that even exist? And finding those, mended little heart, like just finding different programs that work for you, because I think where you are in your journey matters as to how receptive you are to different resources. If you are in that new diagnosis and you're just terrified and you're angry, a support group may not be it right now, because it's so overwhelming and giving so many more options than what you even know are there. And so sticking with your cardiology team and just asking those questions. What questions should I be asking? I don't know what I don't know. So what are the things that I should be asking? What resources are available to me in this hospital to help me navigate right now? And then as you go through your journey, as you're more open to it, then utilizing a pediatrician too, of saying, I'm not okay. How can I get help for myself? Because I forgot for so long that my pediatrician could have done that for me. I could have said to her, I'm not okay. And she could have helped. Once you're cleared from your OB, you're kind of cleared. And so just knowing in those moments, it's okay. Facebook and social media are always fantastic resources, but also remembering that everybody's journey is different. And so reading different scenarios, I had to not do that because my anxiety didn't allow me to separate. I couldn't say, well, this is their story and this is my story, therefore they're not the same. I just saw them all. And so I really think my biggest thing is listening to yourself, being compassionate with yourself, finding your people that you can say your worst thoughts out loud, and they can help you navigate that. They're the ones that will validate. One of my best friends is the person who I would text, and she would say, it is really hard to be a mom right now, and you're doing the best you can, and I'm here for you. And it wasn't any advice. It was just, yep, it sucks
Yeah.
some days. Parenting is really hard at baseline. Being a
Oh,
wife is hard at baseline. There's so many things that are hard, and it's okay to just feel like you're failing in the moment. But having those reminders, faith-based people, like it's okay I am a faith-based person, but I was still angry. I was still mad. And it was walking alongside that journey too. I'm a writer. So if people wanted to connect, I have a blog that I was really active on it at first, and then I kind of trailed back. And I think that that's something your self-care has to meet the need that you're in. So if writing about it worked right then, it worked for me. And then sometimes it was like being present. I love Heart Month. It's my favorite time because it gives me permission to share my story all over again. And so I post about that. So social media, I think I shared my social medias with you, and I'm happy to connect with other people as a mom, as a child life specialist, as a person. It takes a village, and that phrase is so accurate. And it's okay to handpick your village and to pick and choose people that you already have in your world, put them into your own little special village and have them on speed dial. But I think the biggest thing is mental health is really important, in making sure to remind yourself the compassion, but that asking for help does not mean you are failing your child. It only makes you stronger as a parent to say, I need help, and to get that support, because I think that makes such a difference.
mm. Well, we will definitely have you back. And I agree with what you're saying. Like, there's going to be seasons where something will work and something else won't. And it trails off. It doesn't mean that, you're not putting it into it what you used to. It's just, it worked during
Exactly.
that season. So, what is the name of your blog?
It is When Worlds Collide, actually.
When Worlds Collide.
So that
I
is
see a
that
book
is
in your
it.
future, my friend.
That is it is a dream. It is a dream of mine. I would love
Okay,
to make that happen.
let's do it. Well, thank you
Yes.
so much, Kayleigh. I've loved talking with you. I'm so appreciative of your time and all of your insight today. So thank you.
Thank you.
Thank you all so much for listening to Child Life on Call. If you head to our website, childlifeoncall.com, you're going to find all sorts of stuff there for parents, professionals, healthcare providers, child life specialists, no matter who you are. Actually, when you just go to our homepage, it'll help you direct to exactly where you need to go. On that, you'll find opportunities and PDUs for child life specialists. Parents, we've got a starter kit for you. And clinicians, we even have a clinician course, which teaches you how to be a confident and capable caregiver in pediatrics. We're so grateful that you're here. Please DM us on Instagram. And like I mentioned, when you rate and review this podcast,